over to Holly Coy from the Virginia Department of Education. Holly, it's all yours.
Wonderful. Thank you so much, everyone. It's a pleasure to be joining you this afternoon, though my video is uncooperative. I'm going to see if I can share some slides with you all. Oh, Jeremy's way ahead of me as usual. He's picking us up here. Thank you, Jeremy.
You're welcome.
So this afternoon, thought I would cover a couple of different topics with you all, and I'm happy to dive more deeply into any of those or spend more time in one place or the other. So I thought I would give a kind of quick update on all things COVID and let you know about some additional updates coming down the pike. And then shift gears to talk about both the special session, what came out of it as it relates to K-12 education, and to also chat a little bit about what we anticipate coming down the pike for 2021. Now that it is almost November and we've finished special, we're starting to shift gears. So with all right. Yes, and in between COVID and the legislature, I'll provide a couple of other quick updates from our Board of Ed for you as well. All right, so K12 reopenings in Virginia. As you all are well aware, this looks different in every community in the Commonwealth as we've embarked on delivering new instruction to our kids in this age of COVID. So on the next slide, you will see a map of the Commonwealth shaded in different colors. This map is now about a month old. We are updating it next week and has changed quite a bit actually. But this roughly gives you a sense of the different types of modalities divisions we're deploying when we started the school year right around Labor Day, give or take. So you'll see in purple, those divisions that are doing kind of what we considered fully in person, so at least 4 days a week of in-person instruction, all the way to the shaded green there, which is fully remote. There are some nuanced definitions, and I won't get into the details of all of it, but this is on our website. As I said, we're working on updating it. The big takeaway, I think, from this, as we evaluate the Commonwealth as a whole, is when we started school, about 80% of our students lived in a division that was fully remote. There were no in-person options. As of, I guess, end of last week, about 60% of students live in a division that is fully remote. So we're seeing divisions phase in the in-person experience for students. And the state guidance encourages our divisions to phase in that in-person instruction for students for whom the in-person is most critical, who are disproportionately kind of disadvantaged by the virtual experience. So that includes our special education students, it includes our English learners, as well as our youngest students, preschoolers on up through third grade. And we're seeing a lot of divisions kind of start phasing in with those groups in particular. Jeremy, if you'll click ahead for me. One of the things that we are evaluating and trying to keep tabs on throughout the year is the learning loss that goes along with the different modalities of instruction. And the fully virtual or fully remote option does put a number of our students at greater risk of learning loss. And we know that those students are low income, Black and Hispanic. And really what we're seeing and what we're concerned about are some of our equity gaps in education being exacerbated by the pandemic and seeing this play out with learning loss, which happens naturally over the summer. But for our students this year, they went from March through September in many cases with any new instruction. So this is from a national study looking at some of the learning loss numbers and how it impacts different groups of students. But this is something that as we think about instructional modality, as we think about how our students are faring, this is front and center in all of the work that we do at DOE to provide the supports to our divisions to close those gaps. So the next section here, I just wanted to provide a quick update on kind of the guidance from the state to divisions about how they should be thinking about the opening status of their schools. There are some new tools and resources from the CDC and from VDH that I just wanted to bring to your attention in case they weren't already on your radar. So on the next slide, Jeremy, we have the new CDC indicators for schools. And I guess these are about a month old now. They're not so new, but they weren't available to schools as they were making decisions about reopening over the summer, but have since come out. And the CDC essentially says that divisions should be considering three major factors for reopening. Those indicators are the number of new cases per 100,000 people in the last 14 days, the percentage of PCR tests that are positive over that same time period. And then the last one is the ability of the school or the division to implement mitigation strategies. And this, as you can imagine, is not quantifiable like the first two factors. And so, Jeremy, if you'll click to the next slide for me, this is a snapshot of the VDH pandemic metrics dashboard, and you'll see circled there the CDC school metrics. They have run the CDC formulas for every locality in Virginia. And on the next slide, you'll see a snapshot of that. They've categorized it in those same green, yellow, orange, red to assess risk. And this screenshot shows you at the top, you can select the locality and the date, and then it will pull up the data as it relates specifically to the CDC indicators for school decision making. And while this wasn't a tool that our divisions had available as they were reopening in August and September, it is a tool that we now have available as we continue to evaluate the risks associated with different modalities within the context of the larger community. And the community not just being the locality, but the region, and really looking at regional trends as important factors for divisions. These decisions are going to be with us at least for this school year, if not longer. And so this information is supporting and informing, or should be supporting and informing those decisions. Next slide, please, Jeremy. So here's another snapshot from that VDH page. In addition to data, locality-specific data, you can pull up maps of the whole state to see how that plays out. So this is the 14-day case incident from a few days ago. Unfortunately, no one is in green, but you can see kind of where the hotspots are around the Commonwealth. So what do divisions do with this information? How do we think about this throughout the year? We have aligned this with the phase guidance on how divisions can think about, as I mentioned earlier, phasing in-person instruction when the public health conditions permit, serving our most vulnerable students in ways that meet their unique learning needs. But thinking about it along a spectrum of risk that is informed by those new CDC metrics and considerations that VDH has now made public. So the last piece of COVID data that I'll share today on the next slide has to do with the new dashboard that was just released from VDH this past Friday. And I guess I didn't include it. Sorry, Jeremy. There's one last dashboard that VDH has made public, and that is a listing of schools that have had outbreaks. And this is in part due to the good work of Senator Lucas and others in the General Assembly who put forward legislation requiring VDH to publish that outbreak data in a number of different types of settings. And school settings are included, both public and private. And so that is now live. It is a cumulative list. So once a particular school has an outbreak, the status may change on there. So has the outbreak concluded, or is it still in progress? But that data will be available to members of the public going forward. So just wanted to be sure that that one was also on your radar. I thought I would just briefly give you an update on other kind of Board of Education and agency updates. Obviously, a lot of our work these days is focused on supporting the needs of students and staff related to COVID. A big piece of that is mental health and social emotional learning. This pandemic has, like as with many needs, kind of reaffirmed and shone a spotlight on the need to be providing those supports to our students. We also last week released a new equity audit tool for divisions to do a top to bottom equity audit of their operations and policies. This is something that a couple of local divisions have in place, but we have developed a comprehensive tool from the department that can help divisions in evaluating where there may be room for improvement when we think about supporting, providing all the supports that each learner needs in order to succeed. And then finally, and you'll hear more from Kathy and Karin later this afternoon, but the governor's early childhood legislation from the regular 2020 session did kick off a state consolidation of early childhood programs, and that is well underway despite COVID. And so there are programs moving from DSS over to DOE. Some of that has happened already, and the work will continue through until next summer when that governance shift is complete. Just briefly, I'll mention that the Board of Ed has re-prescribed their standards of quality that they issued last fall. This relates to school funding, and there were bills in the session last year related to these updated standards for our schools. The pieces of them were successful, but they were not successful wholesale in getting the funding that they needed. So the board has reaffirmed their commitment this fall to those SOQs. They have also received the updates from the African American History Education Commission, and they have updated the history and social studies standards of learning. This relates to the content and curriculum of African American history in Virginia, and that action was taken at their meeting earlier this month. They are finally embarking on a standards of accreditation review. And the standards of accreditation are the regulations that provide for division and school level accreditation by the state, our accountability system. You may recall that this was revised about 2 years ago. We have some preliminary data about how some of those changes are working, and the board is just embarked on a conversation to evaluate that and ensure that the changes are having the intended effect and will tweak or adjust as necessary. So with that, I'll shift to all things session, both the regular and special, and looking ahead to next year. Oh, sorry, I'm out of order on my slides, Jeremy. Appreciate you keeping me straight.
Sorry about that, Holly. Just let me know.
So I'll pause here and provide just an update on the federal funding related to COVID. There's just one kind of summary slide here, and I'm happy to dive into any particulars or questions that you might have on this. But when we think about K12, think generally about 3 different funding streams from the feds since March. The first, the Elementary and Secondary School Education Relief Fund, was largely driven by the Title I formula accounting for student need, but there was a set aside for statewide responses. The governor also received a discretionary fund that was much smaller, and you'll see some of the highlights on how that money was used. And then most recently, the Coronavirus Relief Fund, the big pot of money from which many of all of your localities received funds earlier this year. The governor just a few weeks ago allocated $220 million from that fund to our public schools specifically. This comes out to about $175 a pupil. The CRF fund, the last bucket there, is the most pressing and urgent for your divisions. As you likely know, they have to spend that money by the end of this calendar year. And so that is the priority, to get those dollars out the door on any eligible expenses. And we're working with our divisions to do so as expeditiously as we can recognizing that the expenditures have been great, to say the least, in this strange year. All right, so now I will properly switch us over to special session and some of the highlights coming out of that for K12. So legislatively, we saw a couple of items related to COVID-19. That outbreak data I mentioned previously. There was also a bill from Senator McClellan to require schools to post their health plans on their websites. This is something we had encouraged them to do previously. Those health plans were required under an emergency order from the Commissioner of Health, but they had not been legally required to post them on their websites. And then we saw a bill from Delegate Rome to require eligible schools to participate in the community eligibility programs. This is a school nutrition program whereby the whole school or whole division can provide free lunches for their students if the student body reflects a certain kind of depth of socioeconomic need. That has been an option, and this bill requires certain eligible schools to participate. On the budget, there is a pause essentially in the enrollment funding until the General Assembly comes back in 2021. In their wisdom, they heard anecdotally that this was a concern. We have heard that divisions have fewer students enrolling this year because of COVID. Again, anecdotally, we have heard those trends are most severe in kindergarten and in 6th grade, where students are kind of in transitions into school. However, the official state count on enrollment is not yet complete. We will have that data in the next few weeks, and those enrollment numbers drive funding. And so the General Assembly asked us essentially to hold on doing anything different with that enrollment funding until they come back in 2021 and are able to look at the data that has been collected and make a determination about the accommodations that divisions might need as a result financially. We did see restoration for early childhood and at-risk students. Generally speaking, from the budget, I think it's fair to say we all fared a bit better than we had anticipated when COVID first broke out in the spring. And then, of course, language for pay increase for teachers contingent in funding in 2022. So that is a very high-level summary of what came out of this special session. And as we look ahead to 2021, we'll see many of these same themes on topics that we've talked about this afternoon. COVID-19, the enrollment loss and the impacts on school funding, I think will be a big part of that conversation as it becomes more clear what the needs are and what those enrollment numbers really look like. Kind of relatedly on COVID impacts, social emotional learning and mental health supports. There's a lot of interest and concern and discussion about providing appropriate supports for our students and staff in that space. I mentioned the African American History Education Commission and some of the work that the Board of Education did as a result of their report this summer, but there are also legislative recommendations that we may see discussed throughout the 21 session. The one item on here, I think it's worth noting that I omitted would also be the role of school resource officers, given the conversations we've had throughout the summer about the role of police and kind of taking the school lens on that, what the appropriate role of SROs is. Our General Assembly has done a lot in the last few years around school discipline and the role of SROs, but we can envision all of that receiving kind of continued attention, appropriately so, and discussion. So I think I went over my time slightly, but that is a very quick rundown on some hot topics in K12. I am happy to answer questions. I saw a couple come in on the enrollment numbers. The question was about, will districts be funded on last year's enrollment numbers? for this year, essentially, yes. One of the ideas on the table that has been discussed is holding divisions harmless for any declines in enrollment. And so that would just kind of default to the previous year's numbers, hold them steady for a year, and then I think reevaluate how those numbers bounce around moving forward.
And Holly, I'm sure, thank you so much for that presentation, and sure, already jumping into questions. I'm sure you might be also seeing in the chat that many of our members are wondering if the presentation can be sent around, and I believe you're okay with that, and we'll be sending this presentation along with others as part of a post-meeting follow-up email.
Yep, feel free.
Yes.
And one other issue, I know if folks have questions, they can put it in the chat. But Holly, one thing that is a concern that we've heard in a lot of our regional meetings and from members of the committee is additional funding for school capital projects. And I know that that's always been an ongoing issue, but certainly it seems that the needs are growing in many communities. And I don't know if you had any thoughts. I know that legislation from 2020 created a special commission from Senator McClellan to look into this issue further, but I don't know if you want to touch on any updates or any thoughts on capital costs and maybe some of the health tax legislation.
Yeah. I mean, you all are well aware it's certainly a perpetual need. It'll be interesting to see as that commission gets going and as we reevaluate what public education looks like post-COVID. And I think we're learning a lot about, good, bad, and ugly about virtual learning and what impact that has on our traditional time and place constraints of K-12 education. I think there are some opportunities for us to innovate in that space. Think beyond our traditional time constraints, our traditional place constraints. But even with all of that, the capital needs of our schools are significant and are growing, particularly technologically. And so I think it is a conversation that will just evolve because of COVID, not by any means, go away.
Thank you.
Any other questions or comments from committee members? All right, Jeremy, we'll move over to our next presenter, Kathy Glazer, who's the president of Virginia Early Education Childhood Foundation, and Karin Bowles, who is a director of strategy for the Virginia Early Childhood Foundation. And I'll turn it over to Kathy first. Kathy, welcome.
Thank you so much. It's great to be with you all this afternoon. See some good friends on there. We're also glad to have a chance to connect with Katie, Senator Lucas. Great to see you today. Actually, Jeremy, if you don't mind kicking up our slides for us, I'm going to let Karin get us started first with the discussion.
Thank you, Kathy. I'm getting that posted momentarily.
Thank you.
And let me know when y'all are able to see that.
Looks good. Thank you. And I can't get my camera to work, but I'm going to say that's probably really fortunate for you all today.
Hey, Jeremy, can you hear me?
Yes, loud and clear.
Yeah.
Okay, great. I was struggling a little bit with the mute button. My name is Karin Bowles. I'm with the Virginia Early Childhood Foundation, and we're delighted to be with you all this afternoon. Thank you for inviting us. Can you go to the next slide, Jeremy? Great. We just kind of wanted to kick off this conversation with some level setting about what we mean when we talk about early childhood education. And for us, early education is school readiness, and it's also childcare, and it's also workforce and economic development. It's a public good, just like the K12 system and just like the transportation system, but it's not always valued as such. Childcare has a dual generational value of supporting working parents in our current workforce, and also supporting a talented future workforce through school readiness. When you hear the term early education, you all may think of different things. Maybe you think about VPI, the state-funded pre-K program for 4-year-olds. Maybe you think about Head Start or childcare, and all of these are under the bucket of early childhood education. There's a range of early childhood programs that vary based on the settings where they occur and how they're funded. Some are publicly funded by the feds or by the state. Others are privately paid. And so for all of these reasons, sometimes when we talk about early childhood education, it can be a confusing conversation. The Virginia Early Childhood Foundation was established to stand kind of at the intersection of state and local levels, and also the public and private sectors. We work with people across health and human services, education, workforce, economic development, with the goal to support the capacity of local communities and Virginia statewide to grow effective and equitable early childhood systems that meet the needs, the strengths, and the culture of communities and families. And just to note before we really kick off the conversation, how we support these earliest brain building years has an impact on every community, on every business, on every school division, and on every one of us. So next slide, please. And so we just wanted to start off on a positive note and cover some of the recent progress that's been made in Virginia. We've seen steady incremental progress over the last several years. We've seen growing bipartisan support for early childhood education, but really the 2020 session was truly a landmark session. The School Readiness Act of 2020, which Holly referenced, is the consolidation of early childhood programs, passed with bipartisan support and, is a tremendous reorganization of Virginia's state level governance. In a nutshell, the bill establishes a unified early care and education system at DOE, governed by the Board of Education. It transfers Head Start Collaboration Office, as well as key childcare functions like licensing, subsidy, and regulation from DSS over to VDOE. DOE will become the lead agency by July 1, 2021, so in less than a year. It establishes a uniform rating system. Participation in this new system will be required of all publicly funded programs, but optional for programs that do not accept public funding. And this uniform rating system also must be in place by July 1, 2021. It also creates an early childhood advisory committee to the Board of Education. It'll be a committee of diverse stakeholders who will advise the board on early childhood matters. So, as I mentioned, this work is well underway between DOE and DSS and will continue over the next several months. Moving on, the 2020 session was also historic in terms of investments in early childhood. The governor proposed $95 million for early childhood in his introduced budget, and the legislature pretty much agreed with him. Thank you, Senator Lucas. Along with those new investments came important policy changes that updated Virginia's VPI program to be more flexible and responsive to today's working families. Some of those are listed on the slide, but it's things like a pilot to expand public preschool to 3-year-olds, VPI slot reallocations to help communities who have wait lists for preschool, a 10% per pupil increase, some adjustments to the class size ratio to permit more flexibility, and a community provider add-on to incentivize partnerships with community-based providers, as well as increased funding for mixed delivery grants. So that increased investment was really meaningful and touched on a lot of strategies to support young children. Also, recent progress includes the receipt of a federal preschool development by Virginia. In December of 2018, we received we're calling it DGB5, another great acronym, in 2018, and it was renewed in 2019 for 3 years. And that totals approximately $43 million in federal funding over 4 years. And this grant is an opportunity for Virginia communities to unify their publicly funded early childhood programs at the local level. Next slide. And so just to dig in a little bit deeper about the PDGB5 grant, Jeremy had indicated there might be some interest in that. The grant is administered through a partnership with VDOE, VECF, and UVA. The goal of every community is for every community to establish or strengthen their birth through 5 system to ensure every child has access to quality early childhood experiences, regardless of their background, their income, or their zip code. PDG provides funding to a lead organization in each community, such as, it could be a school division, a city or county government, or a nonprofit organization like United Way or Smart Beginnings. And these organizations in each community coordinate efforts to systematically improve access to and quality of their early care and education. These community pilots not only strengthen their local systems, they really help inform policy and practice at the state level as Virginia moves towards a more unified statewide system. So you can see on the map where some of these communities are. In 2019, we began with 10 pilots covering 27 jurisdictions. And then in this second year, we're up to 43 counties and 27 cities in Virginia. And the goal is to be scaled statewide by 2023. What this means is we're currently working with more than 1,100 early childhood program sites, more than 3,500 classrooms, and more than 5,000 teachers. One of the other key purposes of the grant is to scale up a uniform rating system, as I mentioned, with consolidation. That's to be in effect by July 1, 2021, to measure and support quality in all of the publicly funded sites. But also this program is giving us an opportunity to pilot a unique incentive program to more equitably compensate early educators in childcare settings, because we know early educators are one of the most poorly paid workforces in every industry. Just as we're celebrating these great opportunities, the grant, the historic investment from the legislature, the pandemic obviously brought devastating disruption to the system. Next slide, please. It's important, for us to note that even before COVID, the childcare industry operated on very thin margins. Public funding and parent tuition rarely met the true cost of care. And these small businesses were left especially vulnerable to the economic problems due to COVID. We face the reality that many childcare programs that close may not open again. And the landscape of childcare will certainly not look the same as it did before the pandemic. Things, as you can imagine, health and safety guidelines and workplace regulations have had a significant impact on operations and revenues for childcare programs. The industry has also been, impacted by the changing needs of parents, their customers, who themselves are impacted by unemployment, teleworking, and health concerns. And with most schools going virtual, the demand for school-age childcare has just skyrocketed and increased pressure on the childcare system. You can see the numbers here on the slide. Over 2,000 childcare programs are closed still, and that's a loss of 148,000 slots. Obviously this is having a direct impact on Virginia's workforce. Tom Barkin, who's the president and CEO of the Federal Reserve Bank of Richmond, noted in a speech recently at an event that we host with the Virginia Commerce that 30% of mothers aged 25 to 44 aren't working because of childcare issues. 30%. This negative effect on women's labor force participation, I saw an article recently, and it's starting to be called a she session instead of a recession, a she session, could really be detrimental to our country's long-term growth. And on top of that, we don't want to forget that these issues really exacerbate the already existing achievement gaps between children from higher and lower income families. So you're seeing some numbers that are really staggering. So what does this mean for, as I've said, and as you all know, childcare is essential for families to return to work and for communities to begin to recover economically. That's a big task, and it's going to be a big task to ensure that this vital infrastructure succeeds. That's going to require local and regional level collaboration, planning, and leadership. And that's from both the public and the private sectors. We need everyone at the table to solve this problem. We've recognized, the foundation has been around for 15 years. We've recognized that it's at the local level that school readiness happens. It's at the local level where the rubber meets the road, where all of the sectors and the funding come together to deliver the promise of early education. We need communities, to really foster cross-sector and collaborative leadership in support of early childhood. We need to help build what someone called the local muscle to pull partners and ideas and solutions together. And we need a robust regional infrastructure to strengthen local early childhood systems. In the short term, VECF is pleased to have been tapped to support the process of utilizing recently allocated funds of $16 million approximately to support partners and communities in building a supply of safe learning spaces for school-age children. Build on the already robust work that many of your communities are already doing and help solve for this really immediate and urgent need for school-age childcare. And while we are certainly, honored and glad to be positioned to help respond to this immediate crisis, we've also been keeping an eye on the future. How can we rethink and reimagine a stronger, more equitable childcare system? And that is a much more optimistic and forward-looking part of the conversation. So I am going to turn it over to our president, Kathy Glazer, at this point to tell you about how we're envisioning the future and how you can be part of that.
Thanks, Karin. Appreciate that. And Jeremy, if you'll move to the next slide. Thanks so much for the support there. So with the onset of the pandemic, the value of childcare as an essential part of infrastructure became more tangible, and especially initially with supporting health and hospital workers with emergency childcare so that they could get to the front lines, then supply chains and on and on. And it's become clear in Virginia and across the country that the current approach to financing and structuring early childhood programs is flawed and insufficient. So we saw the opportunity in the midst of the disruption for a strategy to re-envision a better system and launch the Back to Work Virginia Task Force to seize the opportunity for transformational change for Virginia's childcare system. We brought together key leaders in the 4 stakeholder groups there on this slide that have a stake in our Commonwealth's childcare system. And Dean Lynch and Jeremy have been really important members of the task force and contributors to the deliberation and in bringing sort of the community voice to that conversation. And we've really appreciated that. Next slide. So after 6 months of work and exploration about childcare, the industry, the systems that support access and quality, financing successes and barriers, the task force is rallying around several findings and key recommendations. And while these have not been revealed yet publicly, I'm going to give you a whiff of them today, that these are the assertions that are emerging from their work. First is to really assert a bold goal that by 2030, all Virginia families can access quality childcare regardless of their income. Secondly, to really focus on getting the information we need to be able to build out a strategic business plan and timeline of activities to make sure that there's an equitable system ready to support the bold goal. This won't happen overnight, but in phases over the next decade. And then next slide, finally, to really make sure that we are creating the structures and processes needed to sustain a focused commitment for this big, bold goal 10 years out. So the foundation will be hosting these efforts and engaging a big tent for an advocacy coalition to make sure that we get there. Part of this is identifying the roles of the different stakeholder groups, government, and that's federal, state, and local level, business, philanthropy, community collaborations, so that we're clear on expectations and commitments across these sectors, all rowing in the same direction to reach our shared goal. As you can imagine, there have been plenty of conversations about what the community's role is, the commitment, the anticipated benefit, and the strengths in this discussion of shared accountability. And again, there again, Dean and Jeremy have been really in tune with bringing that perspective. And also Jim Regenbaugh, who I see is on the call as well, has been really thoughtful in helping us think through that perspective and really advocating for what the community perspective should be. And then next slide. So what does this mean for counties in Virginia? You likely can school us in the importance to your community of access to early childhood care and education as an essential component of your thriving economy. You won't be surprised, knowing where I'm coming from, to hear me assert that the short-term benefits in workforce gains and long-term benefits in the future workforce are really unparalleled in terms of an effective strategy to break the cycle of poverty and lift our state up. We need the engagement of local leaders like you to help think creatively about how communities can strategically foster and promote better childcare systems. Many of your localities, those of you represented on the call today, have already led the way with some of the strategies, including public-private partnership, planning strategies, including multi-use zoning, building codes to make childcare more of a cohesive part of community development. Economic development in communities can support embedding childcare into the amenities that attract new business and improve the business climate and employee satisfaction. Your leadership can support the continued integration of childcare as an essential component of societal function and the economic vitality to make your community and this Commonwealth a great place to live, work, and thrive. We are really glad to have a chance to have this conversation with you all today. Glad to hear any questions or comments, and really look forward to providing any assistance that we can with your county's commitment to this profoundly important asset.